exista centru de dializă. Făceam naveta la București.
Where I lived, there weren't any dialysis facilities. I had to travel a few hours each way to get treated at a public hospital. The dialysis machines were very old, and I would feel sick after each session. I had to do this twice a week, and I was just getting by.
A 2002 IFC study in cooperation with the government of Romania found a national health system that ranked far below that of its European neighbors, failing to deliver badly needed health services, particularly dialysis.
People weren't very much satisfied with the services provided in the sector. It was a high demand and there was lack of availability of dialysis posts.
The situation of Romanian nephrology was very bad. Few machines, old machines, few doctors, few resources to properly treat patients.
We didn't have enough filters to use the recommended one per treatment, so we would often reuse a filter 4 or 5 times with the same patient.
Without enough filters or medications, we were unable to fully treat patients. They were prone to getting fevers, skin eruptions, and often more serious complications. To address the need for more investment and better care, IFC advised the Romanian government to plan and implement a pilot program to convert a group of public dialysis clinics to private management and operations. IFC offered its expertise in structuring and tendering a private-public partnership that would attract knowledgeable, well-capitalized bidders willing to step in and replace dialysis machines, refurbish existing public facilities, and build new clinics.
We consider this a good opportunity because we knew this business as providers of technology and equipment, and we knew also the clinical part and the technical service part.
In 2004, 8 publicly managed dialysis centers were contracted out to 4 private health management companies. The pilot centers remained within the publicly funded health system, so patients continued to receive dialysis treatment free of charge, and centers received a fixed fee for treatment from the National Insurance House. The pilot program was externally evaluated in 2008 using a 3-tiered evaluation approach. First, it looked at the before and after performance of the 8 pilot clinics to measure differences across various parameters, such as quality, access, and cost. Second, it compared the performance of the 8 pilot clinics to that of a carefully matched group of 8 non-participating publicly managed clinics. Third, the study team directly visited clinics and interviewed medical staff and patients. The evaluation revealed that clinics participating in the pilot program offered more and better services at lower cost than their publicly managed counterparts.
Everything was renovated in the pilot clinics. Old machines were replaced with new ones. More machines were added. Water treatment systems were upgraded along with quality assurance practices that ensure first-class treatment, hygiene, and maintenance. Clinics now have a proper stock of filters and medications, and patients have new beds, AC, TVs, and a package of support services, including preventive blood screening, food service, and transportation to and from the clinic.
For many patients, the improvement in care is evident in their health.
Before I was doing dialysis only twice a week, but now I can do it 3 times a week. With the new machines, the treatment is more effective and I feel much healthier.
I now receive better dialysis and medications, and I feel well enough to eat, to dress myself, to walk around. I can live like a normal person again. I used to feel very strange after a dialysis session in the public clinic, but now the treatment works. It will help prolong my life. For the Romanian government, the pilot clinics were able to provide more value at less cost.
It wasn't just the treatment anymore, it was a package. And that package covers many things.
Overall, the pilot generated about $40 million in new investment by private providers and nearly $5 million in savings to the Romanian health system. It cost approximately $1 million.
The whole process has demonstrated that working with private clinics is better for the system and for the patients.
But while pilot clinics invested in additional machines, public clinics absorbed new patients by compromising care. They added night shifts and undertreated patients. This was one indication that the national dialysis standards developed by the program had not been properly enforced.
The regulator body should be strengthened, and probably IFC here can give us more input.
Moreover, with delays in new clinic construction, the pilot clinics were unable to increase access above and beyond that of their publicly managed counterparts. They were also less successful in influencing the rollout of the pilot program to remaining public clinics.
The IFC should not consider that this program is finished. I think that all these programs need always some follow-up.
It would be nice if all the centers in Romania were like this, but there are still many public clinics that need help and investment. Since the evaluation, more new clinics have come online, and the Romanian government continues its efforts to convert additional public centers to private management, having fine-tuned its original tendering approach.
The trigger, the beginning has been made, so the natural movement of the patients from public centers to private centers is an unstoppable movement.
To date, almost half of all dialysis patients in Romania are being treated in privately managed centers. With new private providers entering the market, competition has brought notable benefits to Romania's dialysis patients.
A long time we had as a care team the problem what will we do with a new patient. Now, fortunately, we don't have this problem.